Hello, this is Dr. Paola bringing you some tips for the AMC Clinical exam, and today I'm going to talk about the basics. You need to know the rules of the game in order to play it well and clear the exam soon. Most candidates come to Australia to get medical registration and enter into the system via the standard pathway, and they have 2 exams. If you are here, it's because you have already cleared the MCQ, so congratulations. That test is very easy. It's multiple choice questions and testing your knowledge. So you do need to study, but most people do well and has a high passing rate. However, the clinical exam is a different story and is a total different game, has different rules, and people struggle to understand how to prepare. So that's why passing rate is low and most candidates sit many attempts. So the rules are different. Here the AMC Clinical is an oral test and is not focusing on your knowledge and a deep specialized, again, knowledge, medical knowledge, but it's more about how you perform and how you are perceived by the examiner. So you can fake it. You don't need to be an expert, but if you show a few things, it will get your score high. And I'm here to tell you just few important things that you want to consider and prepare well when you are sitting this exam. The AMC and the examiners are checking that you are a safe and caring doctor. Of course, you need to recognize when there's an emergency and something serious is going on. That's why it's important to have a good handful of differentials and always show them and explain your rationale and all the thinking process that you are doing and excluding serious conditions. They want to see that you are caring, you are a good listener, you are empathic, you reassure people, you care about them. They also want to see that you have an organized, logic approach to complete the tasks. You are not jumping from history to counseling or checking one thing here in presenting complaint and going to medical history and then back to, they tell me when did it start happening. So being organized, have an approach is very important, especially considering that there's a time limit. So that's the other thing. They want to see how you perform and how you cope with different clinical scenarios under this short time frame, and also under the pressure and the nerves. Everyone will have that stress and it's normal, but it's more about how you show up, how confident you sound, how well you communicate in simple terms. That's the other thing. Can you explain to a patient a condition or what may be happening in simple terms without overwhelming them, without confusing them, and just giving the information that they need? Also, can you communicate to a medical student, midwife, or a invisible examiner in medical terminology and using appropriate language to discuss, say, the physical examination pathway and the landmarks you are looking for. So this is basically what the AMC is doing and what they want to see. I'm here as a tutor. I've been helping people all around the world to prepare for the clinical, doing private sessions. I also do mock-up exams. So if you need help, understand the basic rules, know how to play the game. See you later.